Welcome, everyone. Thanks for joining us today. Today's session is on building your referral network. We often get questions about this from our students and other practitioners that we know. How do I build this network of practitioners that I would refer to or that would refer to me? Let's chat about this one.
Yeah, it's an interesting one, and we've always got to understand what are the reasons for referral? Who do you refer to? Why do you refer to them? Are you going to receive referrals back? All of these sort of things. And I think there's often the expectation that people will, if you refer to someone, then that's a network that you've built and they have to refer back to you. And it just doesn't work that way. So it's important that we understand why we're doing it, but we've also got to really demonstrate value to the other practitioners, so that there's reason for them to refer to you. And they really need to understand our skill sets and what we can offer, because it should be a collaborative approach at the end of the day for the patient.
Definitely. And I think going one step further, even beyond what you just said, which is in certain, especially in the medical circles, if you are a doctor and you receive a referral from another practitioner, another doctor, it is expected that after you've seen that patient, you would then write back to the referring doctor and say, "Thank you for sending me Mrs. Smith. She presented with these things on this day. Here's what I did, and here was the outcome. Thank you for the referral." And so that level of professionalism that you were just talking about there, that extra sort of feeding back into the referring connection, helps to build that respect and trust and rapport with the other practitioner. So yeah, there is no expectation that you will send patients to somebody that's referred to you, but the least you can do is write back and say thank you and here's what I did for that person.
Yeah, 100%. And I get a lot of referrals. Um, And it's interesting though, because a lot of them are, a patient will rock up and say, "Oh, I was referred to you by XYZ." And I'm sort of like, well, okay, but why? I haven't received any communication from this person. I want to know the reasons that you've been referred to me for. So it gives me a little bit more background. So from if you are referring someone out, you need to write a good referral letter, or make some um, clear communication with that practitioner, as your subjective and objective examination, and what you're trying to get out of this referral, for the patient. I think that's really important, is having that thorough and clear communication, from practitioner to practitioner, and also to the patient. Why are you referring this patient? Eh, you know Sometimes the patient will have this, I guess, subconscious understanding that, oh, maybe they're just trying to get rid of me. It's really demonstrating to the patient, look, this is the reasons for my referral. Why am I doing it? This is the benefits that we hope to achieve out of it. Is this something that aligns with your preferences as well? So I think that's super important too, is to really have that thorough communication with your patient about the referral.
Yeah, that's right. And I think it takes a lot of confidence in the referring practitioner to be able to say, look, I can see the challenges you're facing with this presentation. I probably am not the best person to address all of those factors. I might be able to help with some, but there's some things that somebody else could probably do better. I know the person that can help you. Would you like me to refer you on to that person, or to be able to maybe co-manage or to take over at this point? And that does take a lot of confidence in you as the practitioner to be able to say, I don't need you as my patient. I want you to get the most out of your experience with these health practitioners. And so here's what I want to do for you, not to get rid of you. Here's what I want to do for you.
Yeah, yeah, and I've referred out many patients to sports docs, for example. And when you write that referral, it's sort of, this is what I've found. This is what I think is going on. Your assessment plus or minus intervention is appreciated. And then telling your patient, hey, again, this is what I've found. This is what I think is going on, but I'm just not sure about this. And that way, at least if we can get this second opinion, we can rule out any potentially serious conditions, and then we can move forward with conservative management, as appropriate. So that way, they're thinking, okay, oh, that's good. He's not just trying to get rid of me, but he's being that little bit extra, bit more thorough, so we can work together on this.
Yeah, absolutely. We often get asked the question as well about, like, how do I find the good practitioners to refer to? How do I find the people that I should be sending my difficult, complex patients to. And I think there's lots of different ways of doing this, but often a great way to start is just by asking your patients. Someone will come into you and say, I had a knee reco, and I went and saw XYZ practitioner down the road, and they're really good with my rehab. They really dialed in my exercises and really paid a lot of attention to what I was doing. Can't recommend them highly enough. So the first thing you should do is get that person's name and find out who are they, where are they, and what do they do. And then the next step should be, well, how can I reach out to that person? Maybe I could give them a phone call, send them an email and say, hey, we happen to share Frank, who had his knee reconstruction, last month, whatever it might be. He speaks very highly of the experience he had with you. I'd love 10 minutes of your time to learn more about what you do. And I think that's the key, right? Reaching out to that person who has come recommended, and then going in with curiosity, going in with interest in them, not the intention to build referrals back to you. That will make the world of difference in the outcome of these experiences and approaches to these practitioners. Is if you go in going, hey, we share Frank, the patient, with his knee reco, I'd love to get some patients from you. Like, that will end very, very quickly. So you've got to go in there with curiosity about the person, wanting to know more about them. And that sets you up as somebody who's interested in providing a really good quality service to your patients. And then the respect comes back the other way. Yeah, you've got to build that. You've got to give before you get anything in return. And so going to these people and say, I'd love to learn more about what you do, the areas you specialize in, the things you've got special interests in, your areas of expertise, so that I could potentially send you some more patients from my end that could benefit from what you do. And that will immediately develop respect and rapport with that practitioner, and they're much more likely to give you that 10 minutes, 15 minutes over their lunch break, or catch up after work, whatever it might be. I think that's a really good strategy.
Yeah, fantastic. And that opens up, or it sort of invites them to ask, oh, tell me more about what you do.
Yeah, that's right.
And then, yeah, so from a manual therapist point of view, you get that opportunity to speak to other professionals about what you do and how you can help and how you could work together. It's not always about one or the other. It could be a bit about both. How can we work together on this patient so we're not either doing the exact same thing or having conflicting views and stepping on each other's toes. When we look at patient-centered care and this multidisciplinary approach, it is so important that we do communicate with numerous other modalities that are having care for that same patient. Otherwise, what one person says might conflict what the other person is saying, and then the patient just gets confused, and it can be a bit of a downward spiral from there.
Definitely. And that whole, trying to work with other health practitioners in a patient-centered approach is really important, because you can very much get caught up in your own biases a lot of the time as well. It's like, okay, I don't like this type of practitioner, or I really like this kind of practitioner, and therefore your patient will only benefit from the biases that you hold, and assuming that, of course, those biases are going to work in their favor, because they may very well not. So it's very difficult, but very important to make sure that you don't look with blinkers. You look with, what does this patient need? What skills, knowledge don't I have? What could help them in the broader context if I could work with other practitioners to benefit that person?
Yeah, that's a good one as well. When we think about like why you would refer out, I think there's a lot of fear with referrals. People don't want to lose patients; they want to hold on to them, and obviously there can be financial implications there. There can be pressure from employers to maintain a certain level of clients and repeat bookings and all of this sort of stuff. But I think it is important to recognize. When something is not quite in your level of skills, level of understanding or knowledge, that it's probably the most ethical thing to do for that person is to direct them to someone who can manage that. And it is a challenging one when you are starting out as a practitioner and trying to develop your skills and your understanding. But if you don't quite have that and you're just not sure what's going on, and you're just treating the symptoms, it's really then that you need to recognize and think, okay, what does this patient need? What can I do and what can't I do? And then let's find the appropriate practitioner for this person and refer them on. I think that's super important.
Definitely, definitely. Well, then the next question is, how do I find these practitioners? And we gave the example of, okay, you can ask your patients, who are the people that have really helped you in the past, and use those positive recommendations. But then there's also the opportunity to go and network with other practitioners outside of your circle. And this is one I've seen happen quite a lot, particularly in our courses where we have a lot of modalities come and learn from us in our courses. And so if you were a physiotherapist, it'd be very easy to just attend courses with physiotherapists or just go to the physiotherapy conferences, workshops, seminars, networking meetings, whatever they may be. But that, again, limits you in your capacity to reach out to and get to know other practitioners from other circles. If you're a physiotherapist, you're probably less likely to refer to physiotherapists for problems that your patients present with, because they're more likely to have the similar skill set to you, unless they're a specialist, of course. Likewise, if you're a massage therapist or a chiropractor or whatever it might be, if you're going to refer, it's more likely that you'll refer out to a sports doc or off to a massage therapist or an osteopath or someone that maybe doesn't have the skill set that you have. And so in that case, where do we get to know these people? Well, then I would suggest probably attending events, conferences, seminars, networking days, whatever it might be, where there's a mixture of other practitioners, where you've got the opportunity to spend some time listening to and getting a better understanding of how these people work and think, and therefore getting a better appreciation for how they work and think. And then getting the opportunity at lunchtime, in between sessions, in networking sessions, to reach out to that person and say, hey, I noticed that you work in the same suburb as me, just down the road from me. We should have a chat about what we do, get to know what you do a little bit more, and then you build that network that way. And it's very difficult to just go door knocking, right? Which is, I think, where people fall down, is they'll go, well, I need some places to refer my patients to. I need a good exercise physiologist. Google, exercise physiologist, my suburb. Turn up there, this place looks nice. Oh yeah, that'll do. That's where I'll refer to. But that is just, like throwing a dart at a dartboard in the dark. Like, what's the chances of hitting a good practitioner? It's just pure luck. So use those opportunities to get to know people, be curious, ask questions, be inquisitive. And then through that experience, you might go, this person knows what they're talking about. And therefore, your referral is then going to be worth much more to the patient, because it's based on knowledge, experience, exposure, and an understanding of who that person is and what they do.
Yeah, 100%. So, yeah, multimodal conferences are great. Even just like working at a sports club is such a fantastic way to develop a good network. These people that you'll see at training sessions, on game days, you're surrounded by S&C coaches, physios, ex-phys, sports docs. So, this is a great opportunity to network with these people, build that strong, alliance, and even a referral base from there. So that's a really valuable part. And obviously working in sports, you see that there is the real need for a multimodal approach to managing injuries.
Yeah, definitely. And I think, for me to sum up the key points that I've sort of mentioned here, it's really just, rather than focusing on how you can get referrals, focus on who are the people that can benefit your patients. And it sounds like a bit of a backwards approach for someone who's trying to build a business, right? Because referrals is a nice way to get more patients, more clients into your practice. But it's not the only way. And so if your sole purpose is to go out there and meet people who could potentially send you patients, that's only going to be fairly limiting in its outcome. Whereas if your approach is to go out and meet people who you could benefit your patients, then that's how you build your network. And then over time, they may choose to start referring back to you. And I think that's a bit of a flipping the approach in your mind that will make a big difference for you long term. There are other ways, of course, for you to build your patient lists other than getting referrals. There's lots of marketing approaches and things we've talked about in other sessions, and things we haven't talked about as well. But if your only focus is to get referrals from other practitioners, it's probably going to be a flawed way of building your business. It can happen. It will happen over time, but you have to start with interest in the other person first and interest in the patient first.
Yeah, that's right. It's always got to be that collaborative approach. And I think the communication here is the biggest thing, because if you can go back and forth with that practitioner as well, and, you're telling them what you need from them. They might tell you what they need from you, and then you can compare and contrast from there. But that sort of demonstrates value to them. That, oh, hey, I worked with John last time, and that was a really good relationship. They were really easy to work with. I'm more than happy to send a few more. So it really is this long game. It's a bit of a slow process. But yeah, having that communication, not being hesitant to reach out about a patient is really important.
Yeah, definitely. Oh, any other suggestions, ideas, thoughts on this one? How can we get people to
Another
build
one
this network?
it's just like it's a bit more of a passive approach in a way, but just to go into some clinics, physio clinics, sports med clinics, and grab a referral pad. So, getting one of these referral pads, you can scribble out the details on that. It's a fast and efficient way, but that can be a nice way to send out some referrals. And again, if it's nearby, you can make contact with them. You can, you send a patient to them. You can follow them up. You can see if you can arrange a meeting with them. It's sort of a bit of a domino effect from there.
That's a really good idea. And I've actually done that before too, where I've asked a local podiatrist that I used to work near who was quite good and my patients had good experiences with. I contacted him and said, I'd like to learn more about what you do. They're all the same things we've been talking about here. And I said, if I was to send you some patients, what's the best medium to pass that information on to you? And he said, I've actually got a referral pad. And he gave me a bunch of his referral slips. I thought, what a great idea. I should also have those. And so producing your own referral pads, getting them printed up is not difficult to do. And you can model it off the same idea. If somebody reaches out to you and says, I'd love to send some patients to you, or after somebody sends a patient to you, write them the letter back, send them a referral pad and say, if it makes it easier, here's something you can keep on hand. Not only does it make it easier for them, it also reminds them about you, because that's going to sit on their shelf on their desk. And every day they'll notice it and see it and be reminded about you and what you do. And then they might be more likely to remember you at the time that the referral is needed.
Yeah, 100%. And that's also quite an impressive thing, isn't it? You get something in the mail and you go, oh, wow, like this is, they must be pretty legit.
They take this seriously. Yeah, right.
Yeah, so that's a great idea.
Yeah, nice. All right, well, hopefully everyone listening today and tuning in today has taken something from this. I know it's a challenge that's a really common one for a lot of people. I know we've certainly had lots of questions from people about this. How do I build that referral network? Start with the patient. What's best for them? Build the network of people that you would refer to, and then wait and see what happens. The interest will come back your way. You just got to be prepared for it, but starting and caring about the patient first, I think, is the key. So hopefully that's been useful. Thanks everyone for listening, tuning in today. We'll catch you on the next one.
Thank you.